Stiff person syndrome, also known as SPS, is a rare neurologic disorder of unclear origin. It's as uncommon as they come, affecting about 1 in a million people worldwide. SPS is characterized by progressive muscular rigidity, primarily impacting the trunk muscles. This leads to an array of complications, including spasms, postural deformities, chronic pain, and impaired mobility. Stiffness and rigidity are the hallmarks of this condition, but its cause remains a mystery. Despite its unclear cause, this condition significantly impacts the quality of life of those affected. Diagnosing stiff person syndrome involves a series of tests and evaluations. The diagnostic criteria for this condition have significantly evolved since its first description in the mid-20th century. Nowadays, a common method includes the detection of glutamic acid decarboxylase, or GAD antibodies, found frequently in patients with SPS. However, the exact cause of this syndrome is still a mystery, with the role of GAD antibodies being part of the puzzle yet to be fully understood. Though diagnosis can be challenging, it's a critical step in managing and treating the condition. Stiff person syndrome presents with a variety of signs and symptoms. The most prominent are muscle rigidity and stiffness, especially in the trunk area. This rigidity often leads to spasms and postural deformities. Chronic pain is another common symptom, as is impaired mobility, making even simple daily tasks a challenge. Some people may experience a specific variant of the condition, known as stiff limb syndrome, which primarily affects a particular limb rather than the whole body. These symptoms can be debilitating, greatly affecting the patient's movement and overall well-being. Stiff person syndrome is exceedingly rare, occurring in about 1 in a million people. It's a needle in a haystack situation, making it an intriguing subject for medical researchers. The incidence rate of SPS is not confined to any particular geographical location or race. It's an equal opportunity disorder, most commonly found in middle-aged people. It's like a bolt from the blue, descending without warning and turning lives upside down. Though rare, SPS can affect anyone, regardless of age or gender. Stiff person syndrome does not discriminate between genders, presenting an almost equal male to female ratio. This rare condition affects about 1 in a million people, regardless of their gender. When it comes to survival rates, there's a spectrum. The severity of the condition, the individual's overall health, and how effective the treatment is, all play significant roles. It's important to remember that each case is unique and outcomes can vary greatly. With proper management and treatment, individuals with SPS can lead fulfilling lives. Stiff person syndrome, though rare, is a significant neurological disorder. We've traveled together through its definition, identifying it as a progressive muscular rigidity disorder that affects primarily the truncal muscles. We've explored the diagnostic criteria, the signs and symptoms that can guide medical professionals towards its detection. We've looked at how it's dispersed among the population, with about 1 in a million people being affected. We've also highlighted the incidence rate and the male to female ratio. The crux of our discussion emphasizes the importance of early diagnosis and effective treatment. Understanding and awareness of stiff person syndrome can lead to better management and improved quality of life for those affected. Like, share and comment, subscribe.